Genes, editing the genes, and editing the genes, especially in an embryo, that is something which is coming up very fast. And as far as this thing is concerned, we are having this big issue that we can edit the blueprint of the life. Editing the blueprint of the life, what are the clinical promises which are there, and what are the important, I would say, legal perspectives. There are issues in ethics, issues in legal perspectives as far as different countries are concerned, how far we can go with the editing of the genes. That is quite a matter of debate, maybe sometimes a matter of concern. And I think that if we just take this debate ahead, if we take this issue ahead, it has got different schools of thoughts. But here I am to just enumerate a few points which are under the consideration of the people who are doing genetics, who are doing research in genetics, and let's see where we can go from here. So, as far as the editing the blueprint of life is concerned, we are having so many, I mean, say, implications. And what we are basically doing here is that we are tweaking the gene to change the scene. So, this happens to be a rhythmic sentence, a rhythmic title, but tweaking the gene, I mean to say, how do we do it? Basically, there are the technologies which can change our DNA. And as far as the importance of DNA is concerned, we're very much well aware of what DNA means and what we can do with the DNA. We can just do with the genes. We can add the genetic portions. We can remove the genetic portions. We can fix the genetic portions. We can delete the genetic portions, and as a result of which we can have consequences which we want to have intentionally. One issue is that unintentionally there might be mutations in the genes. That aspect I am not covering here. I am just emphasizing the role of genes as far as editing the genes are concerned. And in this, there is this model which we give the name as CRISPR-Cas9. And this is a very important concept which every, I mean, say, anatomist, which every embryologist, which every genetist should be aware of. And what it is one of the techniques which is fast, which is cheap, and which is very, very accurate as far as editing the genes are concerned. So we just do the tweaking of the gene by various modalities. I will not go into the full process of that, but yes, one thing is important, that we can just do certain things, certain changes in the genes, and we can change the whole scene of the embryo. And what does this mean? This means that what we can do, we can edit the DNA. And editing the DNA has got its own consequences, desirable and undesirable. Now, what is the issue with this thing that we can just change the DNA? We see we have got a responsibility as specialists in the field of genetics, that we can do a lot. But is everything legal? Is everything, I would say, ethical? There are limitations to the things we should be there. We cannot go unproliferated like the cancer cells and go on doing things which we like and create a havoc, whether it is in any modality of life. And as far as genetics is concerned, we can do quite a lot. And the ability to change the genes, especially during embryogenesis, has got a long lasting effect. Now, our future lies not in just understanding the mechanisms of life, but in exercising the power to shape it. And that power to shape it should be positive. It should not be towards a negative thing. It should not be towards an unethical thing. And it should not be that we are masters of science and we can proliferate the scientific knowledge to go beyond limits which just transgress the borders of ethical considerations. So that is very, very important. Now we have got what modalities we use. We can use genomics, We can use stem cell biology, we can use systems biology. With these stem cells, pluripotent cells, especially manipulation of them for personalized embryonic therapies. And once we have got this AI, artificial intelligence, and machine learning, which can just go simultaneously augment all these things, and it can just, I mean, say, increase the pace and increase or multiply exponentially our desires, our benefits, and we have to have a full stop at some point of time what we desire from these things. Now, as far as understanding life to engineering life is concerned, see, this genetic concept is about engineering. Now, it is engineering in medical sciences and engineering at a level which is, I mean to say, submicroscopic level. And what these genetic modalities can do, they can do a lot. I tell you frankly that there are no limits as such. And as far as understanding life to engineer it is, we have got the future and the convergence in the future, as I mentioned about the stem cell and systems biology, the use of artificial intelligence, genomics, and precision genome editing. And what is this precision genome editing with the help of something which I mentioned, CRISPR program nucleases? And what we can do, we can just have, I mean to say, individuals. We can have individuals with, say, so many subsets of diseases. We have got people, I mean, say, individuals with cystic fibrosis. We have got individuals with diseases like hemophilia. We have got, I mean, say, individuals with, I think, say, secondary types of blindnesses, HIV, many types of cancers, thalassemias, and there are so many diseases wherein we can use this a technique of genetic, I mean to say, manipulation to just for the benefit of the patient. So these disease sets, which have got a huge toll on, I mean to say, the individuals, they are some diseases can progress rapidly, they can be lethal, and we have got the genetic manipulation which we can use in a positive manner and address to the source, address to the root cause of these rare genetic diseases rather than the traditional pharmacological therapy which we use by treating on the basis of symptomatology by the use of drugs which have got high toxicity in many cases. But here we use, I mean to say, genes, and we manipulate the genes, we target the specific, I mean to say, cells, and in some cases we can do it well in advance of once the disease is set. So that is important, especially in cases of thalassemia, I mentioned, and cystic fibrosis, where we have used genetic manipulation to treat these diseases. Here, I'm not talking about the genetic modification of the drugs. I'm talking about the rare genetic diseases where genetic manipulation has been found to have a role, and many a times these diseases have been eradicated at a root cause. So, thalassemia, cystic fibrosis, we are well aware of the thalassemia as a hematological entity, producing anemias, producing so many deformities in addition to this thing and complications in which patients suffer a lot, and cystic fibrosis predominantly affecting the lungs, predominantly affecting the glands, and can just progress in a very lethal manner, and the children at an early age can die because of these diseases. And we have been very successful in manipulating the genes to just see that these diseases are not existent at a future level. So, by having, I would say, the manipulation, the therapeutic correction during cystic fibrosis or thalassemia by virtue of genetic manipulation, it is not the end of it. That means that what is in our mind? In our mind is that do we just change the genes in case of embryo to have individuals at a later stage of life with more intelligence, with features like we have? That means the genetic manipulation can be done at the level of changing the individual characteristics. You want a baby to have super intelligent coefficient, a high IQ, you can just do the genetic manipulation to produce the babies with high IQ with a future adult. Once they reach the adult stage, they will be having super high IQ. Number one. Number second, to change the features. You want to have a baby girl at a adult stage having the lip of I mean to say particular dimension, particular quality you want to have. The lips will be modified genetically. You will be modifying the genes there. I don't say that from a plastic surgery viewpoint. You want to have a nose of a typical shape. That nose will be of that shape. So that is genetically engineered babies. That means this is something which is coming ahead and which has got legal implications. How far we can go with genetic manipulation as far as the cosmesis of the baby is concerned, how beautiful a baby you would like to have, how intelligent a baby you would like to have, what classical traits you would like to have in him or her, what features you would like to have in the baby. That is how you can manipulate the genes at an early level. So that is very, very important. My point is that it has got no end. The end is not there. There is a it's an open field, and it all depends upon our manipulation of the genes, where we want to manipulate, how much we want to manipulate, what is our desire, what is the end game, and what we wish to have in there. So that is something as far as the genetic manipulation, genetic editing is concerned. And what is important is that there are constraints as far as the cost is concerned. There are, I mean, say, issues with the tissue targeting, the subtherapeutic and the partial genetic correction likelihood, to what extent you can go. Treating the embryo overcomes the toxicities and subtherapeutic barriers of treating the adult. The issue is that we can have at an early stage pivot cells to target. That is one advantage. Targeting before the disease develops, and that is a very important I mean say role as far as genetic manipulation is concerned. And high likelihood of complete correction by editing their cells at a pluripotent stage. That means that we can do these procedures at a very early stage, identify genetic vulnerabilities in case of individuals who are likely to have, and that's important. So, shaping the future of life by virtue of genetic manipulation is one thing. The ability to manipulate embryogenesis, this is something which is very important, and how much we want to manipulate, that means it's I mean, a matter of considerable debate, though. But these are the implications. But there are positives, there are negatives, those happen with everything, and issues about ethical concentration are there. So, as far as this thing is concerned, I mean to say that we can use genetic manipulation for positive outcomes, we can use genetic manipulation for negative outcomes as well. Some people might use this technology for issues which are not good for overall human race. So, we have to look into that. Thanks.